when I got married, we had an intention of waiting 1 to 2 years before we have our first child. So you can imagine the shock when just less than 1 month into our wedding, I realized I was pregnant. Well, I'm talking to that person today who is saying, help, I am pregnant and it's my first child. This is Blissful Living with Itoro Ebright. We believe everyone can lead a happy, healthy, and fulfilled life. So we talk about 5 F's: faith, family, food, fitness, and fun. And today I'll be talking about what to do when you discover you are pregnant, especially as a first time mom. First, I will say congratulations to you because there are many people hoping and praying every day that what you have just experienced would be their own experience as well. So again, congratulations that you have found yourself in this space. You know, it's inexplicable. I mean, the joy and fulfillment that comes from being a mother. But it's important that you know how this whole thing works as you prepare for this new season of life. Research suggests that babies can detect sound from as early as 16 weeks in pregnancy. I mean, from 16 weeks into pregnancy, babies can detect sound. And by 24 weeks, they can distinguish between sounds. So a mother's voice can be reassuring to a child. Voice can provide comfort for a child, and it can help a child in language development. It also creates familiarity and bonding. So learn to speak to your child. Now that you have discovered you're pregnant, one thing you need to master is the picking and engaging your child. Because from 16 weeks, your child can actually hear sounds. And by 24 weeks, your child can distinguish between sounds. So do not keep quiet. Don't keep quiet. It is time to pray, talk, and shape your child's life through your words and the word of God. You can also seek clarity. Another point I want to share is seek clarity. So number two, seek for clarity and direction for this child that God is giving to you. Ask God some questions. What is it about this child's life? What is your purpose for this child? Why are you sending this child to me? Why did you choose me as a mother of this child? What are the things that I would need to do to help this child achieve destiny? I like what scripture says in Judges 13, verse 12. The Good News Translation talks about the child, the fact that they asked, the parents of Samson asked, what kind of life must he lead? This boy, when this child is born, what kind of life must he lead? And then I think the NLT translation, the New Living Translation says, what kind of rule should govern the boy's life and work? What kind of rules should govern the child's life and work? How should we raise the boy? And what is his life's mission? I mean, I think that's TPT. How should we raise the boy? And what is his life mission? Some children may never live to their full potentials because of the family they are born into. Let that not be the testimony of your child. Let that not be the experience of your child. Ask, make inquiries, seek for clarity and direction concerning that child so that you can begin to mother that child in the dimension or in the direction of God's plan for that child. The third thing I would say is attend antenatals and take your medication seriously. Your prenatal vitamins, do not joke with it. I know that some people do not like taking medication, but when it comes to pregnancy and childbirth, please do not joke with it. It's not about you. You're carrying a life and you should be very intentional about that life you're carrying. Be intentional about taking your prenatal vitamins and then pay attention to the changes in your body. Pay attention to the changes in your body. In fact, some ladies have gotten pregnant without even knowing. 2 months into pregnancy, they're not even aware. They don't keep track of their menstrual cycle. And then some people even get pregnant, okay, like it was in my case. And then they ask you, what's your LMP? And you're like, what is LMP? LMP is your last menstrual period, the first day of your last menstrual period. And once you appear at the hospital and you say you're pregnant, they are going to ask you, what's your LMP? Some women keep looking at the doctors like this, like they're looking at an Egyptian monument. They don't even know what that means in English. So as soon as you're married and then you're sexually active, it's important to take note of your menstrual history because it will be needed when you get pregnant. And then, of course, this will also be needed to calculate your ED, that's the expected date of delivery. So some people get pregnant, they don't even notice any changes in their body. That's not right. So pay attention to the changes happening in your body. You notice anything, do not keep quiet. After some months, you realize that your baby is kicking. So pay attention to see if your child is kicking every day and see if today the child kicked more than yesterday. Just pay a lot of attention to all of this. Another very important point, please, I beg you, choose the right hospital. Make sure you choose the right hospital. Whatever you do, make sure you choose the right hospital. There are several things to consider in choosing a hospital. You don't just look at the building because it's beautiful or it's in your neighborhood and you just pick it. Or because you know the owner of the hospital. That's not enough. The friendship with the owner of the hospital will not save you when you're in trouble. And then the beauty of the facility may not be the most important thing to pay attention to at that time. So here are some things to look out for when you're choosing a hospital. Consider the reputation of that hospital. What's their reputation? Are they an accredited hospital? What are the reviews from their patients? So consider patients review, accreditation, reputation, and then the facility. What equipment do they have? What are the quality of doctors? Some people make the mistake of going to one hospital where you have, maybe you hear that this particular person is a specialist doctor in a particular place, or you met him at maybe a general hospital, and then because he has a hospital, you know that he's very good at the general hospital, so you move to his hospital. Well, you have to be careful because that's the only expert in that hospital many times. The day is not available and there's any complication, you may be in trouble. So it's important to consider many factors before choosing the hospital. The quality of doctors they have, their experience, the kinds of equipment they have. Do they have neonatal facilities just in case it's needed? Do they have basic amenities needed for emergencies when it happens? Is their ambulance working just in case there's an issue and they have to do a transfer? There are many, many, many things to consider when picking a hospital. Of course, you must also consider proximity to the location because you want to consider a place where it will be easy for you to assess when it happens. We don't know where your child will come, whether it's going to be there at night or in the morning. So consider accessibility. Then consider your insurance cover. If you have a medical insurance, you want to go to the hospital and find out if the hospital is registered with your medical insurance. That's one. Another thing you want to find out is category, the class of insurance, medical insurance you're doing covers your delivery. If it covers natural birth, or it covers a cesarean section, or it covers both, or it doesn't even cover anyone, you need to know so you can budget and plan well. Don't assume anything. Ask questions and do your findings well. And then consider their policies on visitation. I've gone to hospitals where somebody's coming to see somebody who just had a baby, and you just walk in from the entrance. Nobody's even asking where you're going to. Big hospitals, I mean, you just get to the entrance and you just pass, and then you're going up until the room you're going to. As far as you know where you're going, nobody's asking you questions. That for me is even very wrong. So you need to consider where you are having that baby. Check their policies, check what's happening. You should even be able to visit the postnatal ward before your time of delivery to see what's happening there and see the experience of other mothers. See what the delivery room looks like. Have an idea of what the environment looks like. I mean, that's where you're going to have your baby. So you want to be comfortable with the place. Consider their fees. Can you afford it? Can you afford it so that it don't get stranded after you have had your baby? So the sixth point I will share is eat right. Now you are carrying another person. Consider what is healthy for that person as you eat. Do not eat what is unhealthy for your child. Do your research. Eat what is healthy for your child. Your child's growth starts from the womb. How beautiful or how well your child will grow begins from when the child is forming. So eat the right meals that will help your child form well, help the brain develop well, the sight, all the organs of your baby is forming as you carry your child in the womb. So eat the right things that will help all the organs form well while also praying for that child. Do not forget to exercise. Exercise your body. I mean, as soon as it is time for you to start exercising, usually from the second trimester, exercise your body. Use your body and prepare yourself for delivery because you've got what it takes. And then begin to shop early. Some people wait until very last minute before they begin to shop. Don't shop last minute because some babies come earlier than the EDD. So you don't want to be stranded and you don't want to have a baby that is looking like an emergency. I mean, you had enough time to plan. So start picking things for the arrival of the baby in bits. Don't wait until you want to buy all in one day. And then when you're picking items, start from the ones that will be needed first. There are some items you will not need until the baby is 3 months old. Why are you buying those ones? The items you know that I'm not going to use this until my baby is 3 months old. Especially when you're working with minimal resources, start with the items you're going to use from day one. If anything happens now, you'll be needing this item. Those are the items to buy first. And then you continue that way till you begin to buy all the rest. There are some of these items that will be available at the hospital. So make your inquiries, find out well before you buy. Buy things that have good quality so that it can last you even longer. And then prepare for delivery. Prepare your mind for delivery. Prepare your body for delivery. Prepare your family for delivery. Just prepare for delivery. One of the things I usually encourage people to do. Okay, I actually did it also when I wanted to have my children. So when I was going to have my first son, I told myself that I didn't want to go through the stress of trying to make anything right before a naming ceremony that will come up in 8 days. So what I did was before the EDD, I already went, made my hair. Yes, I made my hair, and then I got my clothes ready that I'll be using for the naming ceremony. Every other thing was ready, even before I had the baby. Many people do that these days. So you can make your hair, something that will last you 2, 3 weeks after delivery. You can also get your clothes ready. Everything that you need, you can get them ready ahead of your delivery. And then you can also prepare your home. Stock your home, get the ingredients that you will need, because whoever is going to come and stay to take care of you, there'll be a lot of people in the house, so everybody will need to eat. So get all the things that will be needed ready. Make arrangement for someone who would stay with you when you have your baby. You know, some people get very emotional about this decision. I don't think it's something you should be very emotional about. If you're a man watching this video, or you're watching with your wife, or you're a woman watching this video and your husband is by your side, please call his attention. Please and please and please, as you make a decision on who to come and stay with you in nursing your baby, consider the person that will be of help. I have seen situations where people brought someone, maybe you brought your mom to come and help you, but this woman is too old and gray. She cannot help you. And then the next thing that is happening is that the woman is so tired. She comes because she's old, and then she's sleeping. So you are now nursing mother and nursing your baby. So get someone that can really help you. Someone you can send on errands, somebody you'll be comfortable sending, not the one that you'll be too afraid to send. That's why it's not also very okay to choose someone for your partner. I mean, the woman who's going to have the baby should have the right to choose who's going to be with her, because there has to be someone she can be vulnerable with, somebody she will be free to send on errand irrespective of their age. Yes. And someone who's ready to work. And if by any means you're listening to me and you are the mother in question who's going for Mugo, please don't go there and sleep. Don't go there and sleep 8 o'clock, you're on the bed. The person who had the baby is in the kitchen. That's not fair. That's not why they brought you. Get up and help so that the person who just had the baby can recover well. And if you're a man listening to me, ensure that there's someone to help your wife so that your wife can recover well. If your wife does not recover well, you will not like it because you will lose her glow. So get the right person who will be very, very helpful. Make sure there are food items at home so this person can prepare food for you as at when needed, and then try as much as possible to give yourself the needed rest. Eat well, take care of your body, and then do what you can to bounce back so you feel confident about yourself. And before I end it, like, share, and then subscribe to this channel. I would also like you to share your thoughts. How did you feel like when you were pregnant for the first time? What was your experience? And then if you're a first time mom and you found this video really useful, you can share a comment to say that you enjoyed this video. That way you're encouraging us to shoot more videos. And then the last thing I will say, know that you have what it takes. So don't be scared. Focus on receiving your little miracle. Don't be scared of anything. You have what it takes to bet that child. That's why you conceived. So don't be scared. I used to be very scared. Then when I was pregnant with my first one, I was asking myself, can you push a child? Can you deliver a child? Even after delivering the child, I remember I was carrying him one day and I was looking at it, I was like, can I really take care of this child? Am I sure? But I mean, the person I'm talking about is a full-grown man now. So life may throw things at you, and sometimes you're tempted to doubt or question your ability. But I came here to let you know that you have what it takes. Again, congratulations as we await the arrival of your baby. Till I come your way next time, do ensure that you live a very healthy, happy, and fulfilled life. Bye.